23-year-old man was brought in by his daughter since he was having increased incidences of forgetting things. His daughter said that he becomes increasingly frustrated searching for his glasses and keys most of the time. He was helped out a couple of times in the supermarket for forgetting the way out. He recently lost his driving license when he was spotted by the cops driving in the wrong direction of the interstate. Which of the following is the most likely pathology for this presentation? He's brought by his daughter for having increased incidence of forgetting things, okay? So the fact that he's having, sort of memory loss kind of points towards the diagnosis of Alzheimer's disease, okay? So questions like this, once you sort of know the diagnosis, the histopathology, at least what they're asking with respect to this one, it's very like specific for that. So, these kind of questions are like great if you have them on the test because it only takes a couple of seconds to answer them, which means you can actually focus some more time on questions you're unable to answer. So since you already know it's Alzheimer's disease, you know it's going to be an abnormal cleavage of amyloid precursor protein. But anyways, I'll just like explain very quickly why it's not the others. So prion infection points to a diagnosis of Creutzfeldt-Jakob disease. In that particular situation, if the patient were to be diagnosed with that, he'd usually present with symptoms of myoclonus. They'll definitely have mentioned something like that in the question. Or they might have mentioned a rapidly progressive mental deterioration. That's very specific for Creutzfeldt-Jakob because of how rapidly the patient will deteriorate mentally. Okay. In the case of alpha-synuclein defect, this is your Lewy body dementia, which is the second most common cause of dementia after Alzheimer's. But once again, if you look at the histopathology, it's different. Over there, you'll have Lewy bodies, as you will see in another question that will come up. But again, the defect over here is an alpha-synuclein, okay, not an amyloid precursor protein. Okay, option C is depigmented substantia nigra and locus coeruleus. As you know, this is involving your basal ganglia, so it points towards Parkinson's. Patient does not have any of these significant features of Parkinson's, which you can remember by the mnemonic traps. Okay, so that's T for tremor, R for rigidity, A for akinesia or bradykinesia, P for postural instability, and S for shuffling gait. There'll be another question. I think it's the fourth question wherein the patient will present with Parkinson-like features. So we will look at that in the fourth question. Okay, and option E is trinucleotide repeat. Here they're talking about Huntington's disease. Once again, patient, they would have definitely mentioned something along the line of chorioathetoid movement or purposeless, like, jerky dancing like movements. Since none of that is mentioned in the question, and like I mentioned, questions like this where it's very specific for that disease, we don't even have to, go through the other options. If you're sure of it, just go with the option.
Thanks for watching. Please give a thumbs up and subscribe for more.